GAG gene encodes for core antigen. The chance of acquiring HIV infection following needle prick is 0.3%. The common causative agent in diarrhea in AIDS patient is Cryptosporidium. HIV is a retrovirus. CD4 T lymphocytes are infected by HIV. AIDS is caused by retrovirus. Retrovirus is thermolabile. Reverse transcriptase is RNA-dependent DNA polymerase. Screening test for AIDS is ELISA. ENV gene, POL gene and GAG gene. These all are HIV genes. RB gene is retinoblastoma gene. P24 antigen disappears from the blood after 6 to 8 weeks of HIV infection. GAG gene, envelope gene and POL gene. These all are the viral genes associated with HIV infection that codes for structural proteins. A HIV mother delivers a baby. So the following features associated with this case is AIDS can be transmitted from mother to child during delivery. HIV infection cannot be diagnosed in the baby with available methods. Breastfeeding can transmit AIDS. Aspergillosis is not common in HIV patients. Cryptosporidiosis, atypical mycobacterial infection, candidiasis. These all are common in HIV patients. In HIV patient, hemiparesis, headache, vomiting, these all occurs due to toxoplasmosis infection. Co-receptor for R5 variant of HIV virus is CCR5. NEF gene, that is NEF gene in HIV is used for enhancing viral replication. P24 is used for early diagnosis of HIV. Lysis of infected CD cell is seen in HIV infection. Macrophage is a reservoir for retrovirus. A patient with HIV has diarrhea with AFB positive organism in stool. The most likely organism is Mycobacterium avium intracellulare. A person with AIDS-related complex is most likely suffering from opportunistic infection. A non-HIV positive patient is admitted in an isolation ward after an abdominal surgery following an accident. The resident doctor who changed his dressing the next day found it to be soaked in blood. The best method of choice of discarding the dressing is put the dressing material directly in an appropriate bag and send for incineration. Tissue of origin of Kaposi sarcoma is vascular. DNA PCR, viral culture and P24 antigen assay. These all are the following methods used for the diagnosis of HIV infection in a 2-month-old child. HIV infects most commonly CD4 helper cells. A glandular fever-like illness, generalized lymphadenopathy, gonococcal septicemia, presenile dementia. These all are associated with HIV infection. Cryptococcus neoformans causes subacute to chronic meningitis in HIV/AIDS. Giardia lamblia, Isospora belli, Cryptosporidium parvum, Microsporidia. These all causes persistent diarrhea in AIDS. Receptor for HIV is CD4. HIV virus was discovered in 1983. In India, maximum cases of tuberculosis in AIDS patients are due to Mycobacterium tuberculosis. Most common route of spread of hepatitis E is fecal-oral. Serological markers of infectivity of hepatitis B is HBeAg. Hepatitis B is DNA virus. Hepatitis B virus present in India is AYW. Hepatitis D virus resembles some plant viruses. Hepatitis E virus does not go into chronic hepatitis stage. Hepatitis B virus, hepatitis C virus, hepatitis D virus, that is BCD. These all go into chronic hepatitis stage. Hepatitis E is by fecal-oral transmission. Hepatitis C is by parenteral transmission. Hepatitis D is a defective virus. Hepatitis B has got a DNA genome. Hepatitis B virus vaccine contain HBsAg. Dependent hepatitis virus is hepatitis D. Hepatitis B is not secreted in stool. Hepatitis C virus has the highest rate of chronicity among all hepatitis viruses. Hepatitis C virus is diagnosed by the detection of HCV RNA. Hepatitis C virus is transmitted through transfusion of infected food. Among hepatitis viruses, only hepatitis A can be cultured. Hepatitis B, C, and D, these all can be transmitted through blood. Hepatitis B virus and hepatitis D virus, these both can infect simultaneously. Hepatitis D virus can cause more serious infection due to superinfection. Hepatitis D virus cannot infect in absence of hepatitis B virus. Hepatitis D virus is ssRNA virus. First antibody to appear in hepatitis is IgM anti-HBC. HIV virus has single-stranded RNA. An HIV patient complains of visual disturbances. Fundal examination shows bilateral retinal exudates and perivascular hemorrhages. Cytomegalovirus is the virus which is responsible for this retinitis. A 30-year-old lady delivered a healthy baby at 37 weeks of gestation. She was a known case of chronic hepatitis B infection. She was positive for HBsAg but negative for HBeAg. The most appropriate treatment for this baby is give both active and passive immunization soon after birth. A 30-year-old man presented with nausea, fever, and jaundice of 5 days duration. The biochemical test revealed a bilirubin of 6.7 mg per deciliter with SGOT level of 1230 IU per ml and SGPT level of 900 IU per ml. The serological test showed presence of HBsAg, IgM, anti-HBC, and HBeAg. The most likely diagnosis is acute hepatitis B infection with high infectivity. A mother is HBsAg positive at 32 weeks of pregnancy. So here, hepatitis B vaccine along with immunoglobulins should be given to the newborn to prevent neonatal infection. Hepatitis B vaccination is given to a patient. His serum will reveal anti-HBsAg. Anti-HBC is not a marker of active replicative phase of chronic hepatitis B. AST, ALT, hepatitis B virus DNA, hepatitis B virus DNA polymerase, these all are markers of active replicative phase of chronic hepatitis B. About hepatitis B, virus can be found in blood 1 month before jaundice. In hepatitis B, the age of onset determines the prognosis. In hepatitis B, communicable period lasts for months. Chronic liver disease is caused by hepatitis C. Hepatitis C virus is a flavivirus. A young pregnant woman presents with fulminant hepatic failure. The most likely etiological agent is hepatitis E virus. Acute viral hepatitis infection which has the highest risk of progression to chronicity is hepatitis C. Hepatitis A is transmitted by fecal-oral route. Suckling mice is used for isolation of Coxsackie virus. Polio causes descending paralysis. Polio causes element type paralysis. Polio is non-progressive. Appearance of Cowdery type A inclusion bodies are granular. Classic triad of congenital rubella includes cataract, deafness, and CHD. Most common oncogenic RNA virus is retrovirus. Dengue virus is enveloped virus. Alzheimer's disease is not prion-associated disease. Scrapie, Kuru, and Creutzfeldt-Jakob disease, these all are prion-associated disease. Prion disease is caused by infectious protein. Prion disease commonly manifests as dementia. Here brain biopsy is diagnostic. Mad cow disease is due to slow virus. Fatal familial insomnia is associated with prion disease. Creutzfeldt-Jakob disease is caused by prion and also by genetic factors. Prions lacks RNA. Hepatitis A virus is cultivable. A 30-year-old patient presented with history of jaundice for 10 days. His liver function test showed bilirubin of 10 mg per deciliter. SGOT is 1100. SGPT is 1450. Serum alkaline phosphatase is 240 IU. He was positive for HBsAg. The confirmatory test to establish acute hepatitis B infection in this patient is IgM anti-HBc antibody. Reovirus is composed of two distinct capsids enclosing the double-stranded RNA. Type of vaccine available commercially for rabies are inactivated sheep brain vaccine, duck embryo cultured vaccine, human diploid cell vaccine. Rotaviruses responsible for infantile diarrhea. Reverse transcriptase polymerase chain reaction can aid in diagnosis of astrovirus, rotavirus, poliovirus. Cytomegalovirus, measles, retrovirus, these all causes pneumonia. Conjunctivitis is caused by enterovirus 70, Coxsackie A24 and also by adenovirus. Enterovirus, echovirus and also Coxsackie virus, these all are cultivable viruses. Killed sheep brain vaccine, human diploid cell vaccine and Vero continuous cell vaccine, these all are the rabies vaccines which are commercially available. Rabies virus is inactivated by phenol, UV radiation and also BPL. BPL means beta propiolactone. Next question, anti-rabies vaccine is prepared by fixed virus. Swine flu is caused by H1N1. Non-enveloped ssRNA virus is picornavirus. Most virulent dengue fever strain is 2. Antigenic shift results from genetic recombination. Herpangina is caused by Coxsackie A. Hemorrhagic fever is caused by Ebola virus. Class 2 exposure in animal bites include licks on a fresh wound. Next question, 25-year-old girl has been admitted to the hospital with provisional diagnosis of rabies. The most suitable clinical sample that can confirm the antemortem diagnosis is skin impression smear for immunofluorescence stain. Next question, a boy got unprovoked bite from a neighbor's dog. The Animal Control Authority caught the dog and it was found to be healthy. The next step is withhold immunization and observe the dog for 10 days for signs of rabies. Next question, diagnostic of rabies is negro bodies. Soft tick transmits relapsing fever. Casanur forest disease is transmitted by ticks. Hantavirus pulmonary syndrome is caused by inhalation of rodent urine and feces. Most specific for dengue diagnosis is IgM capture ELISA. Dengue fever is caused by 5 serotypes. Dengue virus belongs to Flavivirus genus. Congenital rubella is diagnosed when the infant has IgM antibodies at birth. Congenital rubella is diagnosed when IgG antibodies persist for more than 6 months. Most common congenital defects are deafness, cardiac malformation and cataract. Laboratory diagnosis of viral respiratory tract infections can be established by isolation of viruses using centrifugation enhanced culture, by demonstration of viral antigens by indirect immunofluorescence assay in nasopharyngeal washings, by detection of virus-specific IgM antibodies in single serum specimen. 11-month-old child presents with complaints of respiratory distress. On examination, there is bilateral crepitation and wheezing. The most likely cause is respiratory syncytial virus. Strain for BCG is Danish 1331 strain. Strain for measles is Edmondstone Zagreb strain. Organism causing bronchiolitis in infant is respiratory syncytial virus, parainfluenza, influenza. Next question, new infectious agents are Nipah virus, coronavirus, SARS. Crimean Congo hemorrhagic fever is a zoonotic condition, develops petechial rashes. Recently, this disease has been reported in Gujarat. Next question, man is the only reservoir of typhoid. In India, human infections have been reported dengue virus type of all the 4 types. Pre-exposure cell culture vaccine used in rabies is 3 doses. Next question. Diarrhea in rotavirus infection is due to decreased absorption by villi. Next question. Recommended vaccine for rabies is HDCV. Breakbone fever is caused by dengue virus. Commonest cause of bronchiolitis is respiratory syncytial virus. In a patient with influenza, primary infectious pneumonia is less common than secondary bacterial pneumonia. Negri bodies are seen in infections due to rabies virus. A vaccine for rabies was first developed by Louis Pasteur. Nasopharyngeal carcinoma has viral etiology. Herpes simplex virus 1 causes encephalitis. Varicella zoster virus remains dormant but reactivates later. Herpes zoster virus reactivates and involves the eyes. Cytomegalovirus is the most common cause of congenital viral infection. Cytomegalovirus is a DNA virus. Most commonly, it gets infected in the last trimester. Erythema infectiosum is caused by human parvovirus B19. Adenovirus is a DNA virus. Most common extra skin manifestation of varicella is involvement of CNS. Oral hairy leukoplakia is caused by Epstein-Barr virus. Adenovirus consists of double-stranded DNA. African Burkitt's lymphoma is caused by Epstein-Barr virus. Herpes group of virus may cause malignancy. They are either sensitive. Herpes simplex virus 2 involves below diaphragm. Next question. Varicella are classified under herpes virus. Epstein-Barr virus causes nasopharyngeal carcinoma. Human papilloma virus contains double-stranded DNA. Congenital varicella infection causes limb hypoplasia, cortical atrophy, and also cicatrix. Molluscum pox doesn't grow in egg or in animal cells. Human herpes virus 8 causes Kaposi sarcoma. Cowpox, vaccinia, variola, these all grow in egg and also in animal cells. Slapped cheek sign is seen in parvovirus B19. Pharyngoconjunctival fever is caused by adenovirus 3 and 7. Brick-shaped virus causes smallpox. Live attenuated vaccine for poliovirus produces herd immunity. Poliovirus is transmitted by fecal-oral route. Asymptomatic infections caused by poliovirus are common in children. Myocarditis, pleurodynia, herpangina, these all are associated with enteroviruses. Inactivated poliovirus vaccine is given intramuscularly. H5N1 is bird flu virus. Segmented RNA is found in influenza virus. Commonest complication of mumps is orchitis and oophorytis. Mumps causes aseptic meningitis in children. Vaccination causing intussusception is rotavirus vaccine. Reassortment is typically seen in rotavirus. Vaccines prepared by embryonated hen's egg are rabies. Chick embryo cell culture is a primary cell culture. Human fibroblast cell line is used for cultivation of adenovirus. A neonate develops encephalitis without any skin lesions. Most probable causative organism is herpes simplex virus 2. A 29-year-old person comes with focal seizures. MRI shows frontal and temporal enhancement. Most probable diagnosis is herpes simplex encephalitis. Infectivity of chickenpox lasts for 6 days after onset of rash. A 40-year-old man underwent kidney transplantation. 2 months after transplantation, he developed fever and features suggestive of bilateral diffuse interstitial pneumonia. Most likely etiological agent is Cytomegalovirus. A patient has undergone a renal transplantation 2 months back and now presented with difficult breathing. X-ray showed a bilateral diffuse interstitial pneumonia. Probable etiological agent would be Cytomegalovirus. Renal involvement is seen in cytomegalovirus infection, poliomavirus infection, HIV infection. In a patient with a vesicle on shin, microscopy on Zhang smear showed giant cells. Causative agent is varicella zoster. Hypoplasia of limb and scarring is caused by varicella. Virus causing hemorrhagic cystitis, diarrhea and conjunctivitis is adenovirus. Vaccine preparation requires adenovirus and also vaccinia as vector. Parvovirus B19 has affinity for erythrocyte progenitor cells. Parvovirus B19 causes transient aplastic crisis. Parvovirus B19 infection is spread by respiratory route. Most sensitive test for diagnosis of infectious mononucleosis is monosport test. Vaccine may be developed in chick embryo, varicella line, diploid cell line. A 29-year-old female diagnosed with AIDS has been suffering from a progressive blurring of vision in her right eye. On fundoscopic examination, a small white opaque lesion is noted on the retina of her right eye. The most appropriate therapy for this patient is ganciclovir. Antigenic drift in influenza virus is due to immunity selection to the group of the virus existing in the community. Human-to-human transmission is not seen in Japanese B encephalitis. Human-to-human transmission is seen in SARS, H5N1, poliomyelitis, HIV. An otherwise healthy 3-year-old child is brought to the pediatrician with umbilicated flesh-colored papules on his trunk. The condition is related to pox virus infection. HIV affects T helper cells, macrophages, B lymphocytes, follicular dendritic cells. Emergence or resurgence is seen in West Nile virus and also in Nipah virus. In March 2003, avian influenza outbreak in Netherlands was caused by H7N7. Natural reservoir of Hendra virus is bat. An individual who has received all 3 doses of hepatitis B vaccine and who has never had hepatitis B virus infection would be expected to have HBsAg as the serological marker. Acute infantile diarrhea is most commonly due to infection with rotaviruses. Rabies virus, varicella zoster virus, herpes simplex virus, these all are spread by way of nerves. 25-year-old second gravida lady in her first trimester pregnancy, her son aged 4 has developed chickenpox at home since 1 day. She does not give any history of chickenpox and is varicella IgG negative. The advice given to the mother is to take varicella zoster immunoglobulin. Post-exposure prophylaxis for HIV should be started preferably within 2 hours of exposure. DNA PCR, viral culture, P24 antigen assay. These all are methods used for the diagnosis of HIV infection in a 2-month-old child. Antenatal maternal HIV diagnosis is important to prevent vertical transmission. After vaccination for hepatitis B, anti-HBsAg is the viral marker that should be measured to ascertain whether the vaccine is a responder or non-responder. A mother is HBsAg positive at 32 weeks of pregnancy. Here, hepatitis B vaccine and immunoglobulins should be given to the newborn to prevent neonatal infection. Detection of dengue within 5 days can be done by NS1 antigen detection. The best technique to detect growth in cell line culture is immunofluorescence. To culture influenza virus for vaccine development in chick embryo, the best place for inoculation is allantoic cavity. About hepatitis A vaccination, in low endemicity regions, vaccination is only for high-risk individuals. In intermediate endemicity regions, vaccination is required. In high endemicity regions, vaccination is not required. A young female presents to her physician with low-grade fever, headache and painful genital lesions. Culture detects herpes simplex virus. Here, the herpes simplex virus can be reactivated by emotional disturbances or prolonged exposure to sunlight. 9-year-old male presents with fever and non-specific symptoms followed by distinctive rashes on the cheek. That is, slapped cheek appearance can be seen here. So, the virus that is Parvovirus B19 is the most likely cause of this disease and has been associated with transient aplastic crisis in persons with sickle cell disease. Epstein-Barr virus is associated with B-cell lymphoma in transplant recipients and AIDS. Epstein-Barr virus is associated with infectious mononucleosis or glandular fever. Epstein-Barr virus is associated with progressive lymphoproliferative disease in transplant recipients, immunodeficients, and also patients with AIDS. Cytomegalovirus replicates in epithelial cells of salivary glands, kidneys, and respiratory epithelium. Infected persons with cytomegalovirus carries virus for life and is secreted in all body secretions. Most common agent to cause intrauterine infection of the fetus is cytomegalovirus. HHV6 and HHV7 infects CD4 lymphocytes and macrophages. Here the reservoir is salivary glands. Here it is associated with exanthema subitum or roseola infantum. Adenovirus causes pharyngoconjunctival fever with types 3, 4, 7 and 14. Adenovirus causes infantile gastroenteritis with type 40 and 41. Adenovirus causes acute hemorrhagic cystitis in infants and children with 11 and 21. In molluscum contagiosum, we can see painless umbilicated pearly white nodules on trunk and anogenital area. Here the molluscum bodies are diagnostic. Inverted fir tree appearance can be seen. Papovavirus is non-enveloped icosahedral double-stranded DNA. JC polyoma virus causes progressive multifocal leukoencephalopathy in patients of Hodgkin's disease, CLL, and AIDS. BK polyoma virus persists in kidney for life. The marker to detect superinfection of hepatitis D in hepatitis B patient is IgG anti-HBC. Two siblings ages 2 and 4 experienced fever, rhinitis and pharyngitis that resulted in laryngotracheobronchitis. Both had harsh cough and hoarseness. The virus responsible for this condition is parainfluenza virus. Next question. An immunocompromised person with a history of seizures had an MRI that revealed a temporal lobe lesion. Brain biopsy results showed multinucleated giant cells with intranuclear inclusions. The most probable cause of the lesion is herpes simplex virus 1. Parvovirus infection, the cause of mild exanthem in children, can also cause aplastic crisis. Next question. Within the first year of life, an infant exhibited severe hearing loss, ocular abnormalities, and apparent mental retardation. Cytomegalovirus infection was detected by viral isolation and PCR. Here, the cytomegalovirus can be transmitted across the placental barrier. Fifth disease is associated with parvovirus B19. Roseola infantum, double-stranded DNA virus, and exanthema subitum, these all are associated with HHV6. Human papillomavirus 6 and human papillomavirus 18 are mainly sexually transmitted. Influenza A virus may cause antigenic shift and antigenic drift. Influenza A virus may cause pandemics. Influenza A virus responds to neuraminidase inhibitors. Respiratory syncytial virus may cause bronchiolitis. Respiratory syncytial virus is an RNA virus. Respiratory syncytial virus belongs to paramyxovirus. Hepatitis B virus DNA, HBsAg and HBeAg, these all may be present in chronic hepatitis B virus infection. Hepatitis B virus is a DNA virus. Hepatitis D virus is a defective virus. Hepatitis C virus belongs to flavivirus. Subclinical infection is not seen with measles. Subclinical infection is seen with diphtheria, polio, and also Staphylococcus aureus. Glandular fever-like syndrome is produced by cytomegalovirus, Toxoplasma gondii, and also with infectious mononucleosis. Pole Bunnell test is used for infectious mononucleosis. Pharyngitis is most often caused by viruses. Tiger mosquitoes are Aedes. Pneumonia is caused by influenza, cytomegalovirus, and also by varicella. A 9-month-old infant presents to the diarrhea clinic unit with some dehydration. The most likely organism causing diarrhea is rotavirus. Early diagnosis of acute hepatitis B infection is made by presence of IgM anti-HBC in serum. An 8-year-old child recently had erythema infectiosum. Her 33-year-old mother subsequently developed arthralgia, followed by painful arthritis with swelling in the small joints of both hands. In addition to the apparent tropism for joints, human parvovirus B19 is highly tropic for erythroid cells. Echoviruses are cytopathogenic human viruses that mainly infect central nervous system. Next question. A 10-year-old boy is taken to his pediatrician after experiencing fever, malaise and anorexia, followed by tender swelling of his parotid glands. Mumps was diagnosed on clinical presentation. Here the virus is mumps virus, which belongs to paramyxovirus. Human is the reservoir and this case is preventable by immunization. The vector of Japanese B encephalitis virus is Culex mosquito. Hepatitis E increases mortality in pregnancy. Virus implicated in nasopharyngeal carcinoma is Epstein-Barr virus. Diagnostic of rabies is Negri bodies. Chikungunya is transmitted by Aedes. Sabin vaccine, BCG vaccine and 17D vaccine, these all are live vaccines. Castaneer forest disease is a virus disease which is tick-borne. Hepatitis A virus, C virus and also D virus, these all are RNA viruses. Commonest cause of acute bronchiolitis in children is respiratory syncytial virus. Genetic reassortment is found in rotavirus. Regarding varicella, secondary infection rate is more than 90%. Vaccine protection rate is high. Varicella produces rash in flexor surface of forearm. Chlorination does not affect poliovirus. Zhang test is used for diagnosing chickenpox and also for herpes simplex. Demonstration of inclusion body is diagnostic in rabies, molluscum contagiosum and also for trachoma.